If you have ever been told that your headaches are cervicogenic, meaning that they are coming from your neck, I want to talk to you today about something that most women in this situation never hear from their provider. The neck is not the problem. Now, I know that sounds like I am dismissing the diagnosis, and I'm not, because cervicogenic headaches are real. The pain is real. The connection between your cervical spine and your head pain, it's real, and it is well documented. But here's what the diagnosis does not tell you. Why is your neck producing that pain in the first place? Why does the tension keep coming back even after the adjustment, the massage, the physical therapy session? Why does it feel better for a few days and then you're right back where you started? And those are the questions that I want to answer today because when you understand what is actually driving the cervicogenic headaches at the root, the treatment approach looks very different from what most women have been offered. So, this episode is going to be a little bit shorter than usual. We're going to be under 20 minutes today because the message is actually pretty simple once you see it clearly. All right, so let's start with what the label actually means because most women who get this diagnosis leave the office without a clear explanation. A cervicogenic headache is a secondary headache. That means the pain is not originating in the brain itself. It's being referred from another structure, specifically from the joints, discs, muscles, nerves, or soft tissue in the upper neck and cervical spine. What makes it confusing is that it can look and feel almost exactly like a migraine. It can be one-sided. It can radiate into the forehead, the eye, the jaw, the temple. And it can be severe and debilitating. And it often does not respond well to typical migraine medications, which is frequently the first clue that something else is involved. Key things that actually point towards a cervicogenic headache rather than a primary migraine is the pain starts in the neck or the base of the skull, and it gets worse with certain neck movements or positions. There is this like reduced range of motion in the neck. And the pain, it's consistently one-sided and it may be linked to an old injury, to posture, to jaw tension, or how you sit or how you sleep. Now, here's the important piece, and this is where conventional medicine stops short. This can overlap with migraine. Somebody can have both. And for many of the women that I work with, the neck is not a separate problem from their migraine. The neck is one of the drivers feeding the migraine pattern. It's the two are not either or, they are totally connected. And when a woman gets an actual cervicogenic headache diagnosis, the standard recommendation, they're usually some combination of physical therapy, chiropractic manipulation, massage, acupuncture, or targeted neck exercises. And I can say this with 100% confidence because hello, guess who did all of this? I mean, I spent over $5,000 in a couple months at physical therapy. And I want to be clear. I am not saying these things have no value, right? I am not saying a physical therapist or going to a chiropractor. I love my chiropractor or a massage. When am I going? I'm going this week on like Wednesday or Thursday. I love those things. Manual therapy and targeted exercise have research support for reducing headache frequency and intensity in cervicogenic headache. That evidence is real. But here's the question I always come back to. Why does the relief not last? Why does the woman who gets an adjustment every 2 weeks feel better for 3 days and then tighten right back up? And those are good numbers. And typically, the women I'm talking to, they're getting adjusted once or twice a week, and the adjustment's lasting less than a day. Why does the one who finishes a full course of physical therapy like me feel improvement maybe during the treatment a little bit, and then slowly slide back to where she started. And why does the neck keep producing the same tension, the same restriction, the same referred pain over and over and over again? Because the structural intervention is not addressing what is causing the structure to behave that way. So think about it this way. If your neck muscles are chronically tense and inflamed, and we work on releasing that tension manually, right? We've addressed the output. We've not addressed the input. The input is still running and the output comes back. So what is the input? We have to know the input to make a difference. And that input is systemic inflammation, nervous system sensitization, a body that has been in a chronic low-grade threat state for months or years or decades, where the muscles of the neck and the jaw and shoulders are braced constantly. Not because of posture alone, but because the nervous system has actually learned to hold that tension as a protective response. This is a learned response. So chiropractic manipulation, physical therapy, acupuncture, these work at the structural level. They can interrupt the pattern temporarily, but when the underlying inflammatory load is still high and the nervous system is still sensitized, the structure goes right back to where it was because the system driving it, it hasn't changed. Now, this again is not a criticism of those modalities. It is a recognition of their limits when it's used in isolation and without addressing the root cause. Now, functional medicine, it asks a different question about cervicogenic headaches. It asks a totally different question than conventional medicine does. Conventional medicine, it's going to ask, where is the pain coming from? And what can we do to the structure to reduce it, to band-aid it, right? Symptom suppression. But functional medicine asks, why is this structure chronically inflamed and sensitized? And what's keeping it that way? That shift in question changes everything about the treatment approach. Now, here's what the functional medicine lens reveals. Chronic systemic inflammation does not just affect the gut or the brain or the cardiovascular system. It affects connective tissue. It affects the muscles and the joints of the cervical spine. It affects how the nervous system processes pain signals coming from the neck. And it lowers the threshold at which those signals get interpreted as headache pain. This is why a woman can have a perfect posture and still have cervicogenic headache. This is why another woman can sleep in the wrong position one night and wake up with a 3-day headache, while her sister or her friend can sleep in the same position and feel nothing. The structural trigger is the same. The inflammatory and neurological context is different. Nervous system sensitization is the other piece that conventional treatment almost never addresses directly. When the nervous system has been in a chronic pain state for so long, it becomes sensitized, meaning it amplifies signals that would otherwise be filtered. The neck, it sends a normal signal. The sensitized nervous system turns up the volume. And what would have been a mild tension becomes a massive headache. Manual therapy cannot desensitize the nervous system. Adjustments cannot lower systemic inflammation. These are not structural problems with structural solutions. They are system-level problems that need system-level solutions. Jaw mechanics and TMJ patterns also feed into this more than most women realize. The jaw, the neck, and the nervous system are in constant communication. Chronic jaw tension, which is often driven by the same nervous system sensitization and inflammatory load can directly amplify cervicogenic headache patterns. So treating the neck without looking at the jaw is like treating one side of a connected chain and wondering why the other side is still pulling. So if manipulation and PT and acupuncture are not the answer on their own, well, what is? The same thing that addresses chronic migraines at the root, getting the inflammatory load down, calming the nervous system, addressing the inducers that are keeping the system in a sensitized, high alert state. Now, in phase one of the work that I do with women inside the Freedom from Migraine method, we address the inducers that are loading the system. And what I consistently see in women who have a cervicogenic, component to their headache pattern is this. When the systemic inflammation comes down, the neck stops being a constant source of referred pain. The tension's still there sometimes, but it no longer crosses the threshold into a headache the way that it did before because the threshold has risen. The neck was never the problem. The neck was the place the problem was expressing itself. And I see this in my life. I have not had a migraine in almost 15 years, and I had daily migraines for over 10 years. But every once in a while, I start getting this neck discomfort. Now, my threshold is super high. I've been working on it for a long time. I've worked on desensitizing my nervous system. But when that neck pain comes in, it is like my little warning sign, letting me know that that inflammation is starting to creep up. And as long as I go back to working on the phases that I work with my clients on in the Freedom from Migraine method, that neck discomfort comes right down and I have no fear of a migraine. One of the women that I have worked with came to me with what she described, kind of like me, as constant neck-based headaches that her chiropractor had been treating for years. She got so many visits a year, and then she was buying package after package with her chiropractor because she felt like she had to go, otherwise she couldn't function. And she did see some improvement with treatment, but it always came back within a week. Now, within the first phase of our work together, as her inflammatory load began to come down, she told me the neck tension was the same, but it was no longer turning into a headache. The input had not fully changed yet, but the system processing it had. And this is the difference between working on the structure and working on the root. And the longer she worked at it, the less her inflammation was, and the longer the time was between migraine until she achieved her migraine freedom. Now, if you have a cervicogenic headache diagnosis, or if you suspect your neck is part of your headache pattern, I really want you to take this one thing away from today. The label, sure, it can be useful. It tells you where the pain is coming from, but it does not tell you why. And the why is where the solution lives. You're not broken. Your neck's not broken. Your neck's not your enemy. Your body is doing exactly what a body does when it has been carrying a high inflammatory load with a sensitized nervous system for a long time. It is expressing that load in the place it is most vulnerable for you. That's why you might have the neck pain and somebody else doesn't. It is where you are most vulnerable. And when you address the system, when you get the inflammation down and calm the nervous system, the neck stops being a crisis. And the headache that seemed like a structural problem starts to resolve along with everything else because they were never separate to begin with. Now, if you want to understand what this looks like for your specific situation, the link to book a complimentary migraine breakthrough assessment, it's right in the show notes. It's a one-on-one conversation where we look at your full picture and help you understand what your body is actually dealing with at the root. If this episode sounds like somebody you know, please share this episode with them. No one needs to deal with the constant neck pain and constant migraines. All right, everybody, here's to your migraine freedom, and I will see you in the next episode.